Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also you can download several ebooks also free. Trance induction methods in direct clinical hypnosis. The falling back method. We all go into trance several times during the day. How many of us have not been in trance when we are driving home from our workplace, and once we get home, we do not remember most of the journey or some part of it? Have I gone through the roundabouts and the traffic lights? How long have I been driving? Also, when we get lost reading a book, watching a film, or meditating, our attention is concentrated and the state between sleep and wakefulness is created. Do you remember a time when you were daydreaming without being aware of what was going on around you? To a greater or lesser extent, all these moments are trance states. Trance induction methods are techniques to inhibit the patient's conscious and allow the unconscious to appear, giving about 20% conscious and 80% unconscious, thus increasing suggestibility. There are many different types of trance induction. We, from direct clinical hypnosis, as a method of trance induction, we use the combination of systematic relaxation of hypnosis plus visualizations. All of this combines with filters, deepening exercises, complementary relaxations, enhancers, etc. To shorten the introduction to trance, we use the application of a keyword as a key. That is to say, once we have the patient in deep trance, we introduce him or her a keyword, which will serve as a key to return the patient to the trance state without the need to use any induction exercise. Normally, once we say the key again to the patient automatically goes into trance. Some patients do it 100%, others not so much, but we do not need to apply the full trance induction exercise. We can continue with the induction exercise so that the patient enjoys the relaxation before the application of the treatment. As the trance entry process is shorter, we have more time to apply the treatment and also the possibility to loop the treatment several times. As mentioned above, there are many methods of trance induction. There are probably as many methods as there are hypnotherapists. In the following, we will look at 4 trance induction methods: the falling back methods, the situational methods, the boat methods, and the tennis methods, and a 5th method, the HPCs method, which is the one we normally use in clinical practice. This method has been developed by us as a result of these 4 methods that we are going to see. The unconscious state dissolves when it is illuminated by the light of consciousness. Hence, the importance of applying a good induction method that allow us to access the patient's unconscious and maintain it in this state throughout the hypnotic session. Method of falling backwards. The greatest obstacle to this technique on the part of the subject is falling to the ground. To fix this, it is enough to explain to him that it is only a test, that at no time will he fall asleep, that he will always be awake, and that at no time will he enter under hypnosis, and that therefore he will not run any risk of harming himself by falling backwards, since he will react consciously in order not to fall by putting his foot backwards, as if he were an awake person being pushed backwards. Be careful if you have to catch the patient so that he or she does not fall. That's why you have to make it very clear to them that if they see that they are falling backwards, they should react, open their eyes, put one foot back, and that's it. Let's start. Make the subject stand up with his feet together and his arm relaxed and all his muscles relaxed. First of all, explain to him what is going to happen. You are going to stand with your feet together and your eyes closed. Then I will stand behind you. I will touch your shoulders, each with one hand, and I will keep my hands on your shoulders, but no longer touching them. From this moment on, you are going to concentrate on your whole body, and specifically on one special fact. I will start talking to you, and you will see how soon your body will begin to sway. From then on, you will feel a strange force. It will be moving it and pushing it backwards. The more effort you make to stand up, the more difficult it will be. The more difficult it's going to be. As you will be conscious at all times, if you see yourself falling, I want you to react by opening your eyes and putting one foot back to prevent yourself from falling. This will mean that you are ready for hypnosis. From now on, your body starts to move. Your body feels strongly pushed backwards. Stop resisting. These small movements, they are increasing more and more. Stop stopping them. It is impossible to keep still. You feel like a strange force pushes your body backwards, harder and harder. You feel your body falling. You fall down. You fall down. You are tired of standing. You fall down. You fall down. Tip: if this does not work, try changing your tone of voice until you find one that works. Speak to him in the present tense, as if it were happening. Once he makes a small movement, make him believe that it was caused by that strange force. See, your body has moved. From now on, that strange force takes control of your body and starts to push you backwards. It is impossible for you to stand any longer. That strange force is stronger than you. The movements are getting stronger and stronger, and you can feel them. You see how they are stronger, and it is impossible for you to stand any longer. So on and so forth until he falls down. The normal time for a person to fall down is 2 or 3 minutes. Now, the therapy. Warning: there are also people who fall down after 10 seconds, so we must be prepared at all times in case they do not react and fall down. This test works as long as we are attentive to any movement and we make the subject believe that this movement has been infused by this strange force. We know beforehand that a person who stands with his feet together will sooner or later make some movement. Sooner or later, he is going to make some swinging movement. So we'll start by telling him that a strange force is trying to move his body. And because we know that he will swing, when he does, we will say, "See, the movements are starting." This is essential. In this way, we make his unconscious believe that whatever we tell him next comes from that strange force. If we told him that a strange force was going to start rocking him, now that we will tell him that his body feels strongly pushed backwards, he will unconsciously believe that he feels like he is being pushed backwards. he'll unconsciously believe that he feels pushed backwards and he will inevitably fall backwards. This is what suggestion is based on. It is to make you believe that something will happen, which we all know will happen, just because the hypnotist says it, and it happens. So, whatever the hypnotist says will happen. If you're interested in learning more about clinical hypnosis, watch the following video: Trance Induction Methods in Direct Clinical Hypnosis, Situational Methods. Read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.